Hi, everyone. Welcome back to Monday Medz Health Nuggets. I'm your host, Tanisha Lawrence, with Monday Medz Health and Wellness Ministry. So, yes, we have been journeying through the Mind Your Mind series, and this one will touch each and every one of us listening, especially if you're between teenage years and old age. And of course, that would be maybe all of us listening now, especially that many other individuals are in school. So, as we talk about the Mind Your Mind, we know that this series is extensive. It is very extensive because our mind is so vital and we need it in every sphere of our lives. And as we talk about spheres of our lives, yes, this topic we're speaking about today is one that is critical. I know we've been talking about depression. However, we have not talked about depression specifically as it relates to hormonal changes. And so, yes, we are talking about depression from hormonal perspective. And the first hormonal perspective we will share from is about PMS. So, yes, ladies, we know about PMS, we know about premenstrual syndrome, PMS. And PMS is basically the hormonal shift or changes that a woman experience, well, that a girl can experience and even women can experience as we go through the menstrual cycle each and every month. And as we talk about menstrual cycle, we know that this is a cycle that runs basically on a 28-day cycle, on a 28 period of time. And as we say period, the menstrual cycle is also referred to as the period. As individuals, we know that our bodies, we do carry both male and female hormones. As women, and yes, as men, we do carry male and female hormones. However, women we have two female hormones, which are called progesterone and estrogen, or if you want to say estrogen. And when there is a period, the estrogen and the estrogen level, they tend to fluctuate around the menstrual cycle. And sometimes these can trigger mood swings in a woman. And yes, men, we have to be gentle with women, especially around their menstrual cycle. And as a woman, I can tell you from personal experience that a lot happens within the body of a woman around the time of her menstrual cycle. A lot happens in the brain and also in the mind of a woman around the menstrual cycle. So this is important, and I cannot stress it enough, men, that you have to ensure that you go very gentle and give extra love and support to the women in your lives and the girls in your lives around this time of the month. And many times we'll say it's that time of the month. Yes, it's not just that time of the month. It is a serious time of the month. And so we have to ensure that we show extra care towards women around their menstrual cycle. So there's PMS, or premenstrual syndrome, and this can cause feelings of depression, which, like I said, is linked around the menstrual cycle. And there's also a more severe term that is called PMDD. Have you ever heard of it? PMDD? Well, if you have not heard of it, it is called premenstrual dysphoric disorder, or dysphoric disorder. So PMDD. And this one, it does cause a more severe symptoms than PMS. And PMS can cause um, mood swings, it can cause pain, it can cause, which we call cramps, it can cause extra bleeding, it can cause so many things in the body that can set the body's equilibrium system off. Ladies, we need to understand these changes within our bodies, and also men. It is important for you to understand these changes in the bodies of the women that are in your lives. So, PMS and PMDD conditions are caused by hormonal fluctuations, as I said before, and they can be managed if we do some lifestyle changes and also get in extra supplements such as calcium and magnesium in our diet. So, yes, the rise and fall of hormonal changes in our bodies, like estrogen and progesterone during the menstrual cycle, can impact mood. And yes, it can lead to feelings of sadness or depression. PMDD is a severe form of PMS. It can cause anxiety, debilitating depression, and even suicidal thoughts for 1 to 2 weeks before a period. So, PMDD, which we said before, is premenstrual dysphoric disorder, and this can show up 1 to 2 weeks before the menstrual cycle. So, ladies, if you find that you're feeling overly depressed or feelings of sadness, this can be an indication that you're experiencing PMDD. So it is important for you to talk with your primary care physician or your gynecologist on how you could best manage these hormonal fluctuations in your body. And as we talk about managing these symptoms, it is important for us as women to try to reduce our stress level as best as possible. And we did talk a lot about how to reduce stress in a previous feature. And one of the best way we can reduce our stress level and deal with symptoms of PMS or PMDD is to ensure that we do deep breathing. Yes, deep breathing, like inhale and exhale. Yes, inhale and exhale. And yes, you inhale deep breathing and you hold it for a couple seconds and then exhale. You will be surprised to know how that simple activity help your mood and your brain. And yes, if you think about it, when you feel overly stressed, what does the body naturally do? We do a thing like this, like, right? We do a natural quick breathing, which is sometimes done on impulse. It is important, though, that we take time and do this intentionally. All right. And so, yes, we need to reduce our stress level, whether it is you're gonna exercise for at least 30 minutes or go for a long walk. And if yoga is your thing and you want to participate in that, go ahead. Or you could get a nice massage. And these can help to reduce stress and anxiety. Also, it is important to get plenty of sleep that will help to regulate your mood. Also, in managing PMS and PMDD symptoms, it is important that you seek medical help. And like I said, it is important that you speak with your primary care physician or your gynecologist that can help to guide you with these symptoms. Now, sometimes they may offer medication such as some antidepressants. Be careful though that sometimes antidepressants can increase feelings of depression. And as it says, antidepressants. So it is supposed to counteract depression. However, sometimes these things that counteract depression tend to trigger it. And sometimes it does trigger suicidal thoughts. So be careful and bear these things in mind. Sometimes they also offer hormonal therapy, especially for PMDD. If you're just joining us, we've been talking about some of the life changes, some of the events in our lives that can cause depression. And we've been talking about PMS and PMDD. Now, PMS is premenstrual syndrome, and PMDD is premenstrual dysphoric disorder. Also, it is important that you track your cycle. So, yes, ladies, it's important that you take a calendar and you, preferably one that you can place in a private area, and track when your period starts and when it ends. And it is important that you know when you can expect your next period. Now, these are questions that your gynecologist would ask you also. So it's important that you have this information right at your fingertips. Another treatment option that your doctor may recommend is birth control. And hormonal birth control sometimes is used to manage and treat PMS or manage PMS symptoms. Some hormonal birth control options that may be used is the pill or the patch. And these tend to increase depression and other emotional and physical symptoms. Be aware of the spin-off of using these treatments. This is a very lengthy topic as we talk about PMS and PMDD. In the next feature, we will talk about menopause and also one that affects men. So definitely look out for the next feature. And yes, if you have girls, please educate them as to how they can deal with whether they have PMS or PMDD. This is vital, not just for our women to know, or us as women, but also for our daughters and our nieces and the girls that are in our lives. As we wrap up Monday Meds today, I reminded of the Word of God that Jesus says, "Come unto me, all you who labor and are heavy laden, and I will give you rest." Yes, as we talk about PMS and PMDD, it can be laborious to go through a menstrual cycle. And yes, I speak from experience. But remember, Jesus says that, "Come unto me, all you who are heavy laden, all you who are burdened." And he said, "I will give you rest." I pray you'll have a peaceful day, everyone, and God be with you. See you soon.